This is an educational video. We will show you how to maintain an ICU for COVID patients and take precautions required for the intensive care unit whenever a sick patient with COVID infection lands up in an ICU. So this is the entrance of the ICU. So at the entrance of the ICU, so there will be a security personnel who will be with hand sanitizer for all the staff entering the ICU. The flu clinic area where we have a designated doctor with required protection sitting in the flu clinic who will be only screening the patients with flu symptoms. Any patients coming with cough, fever, breathlessness will be screened here. So these are the basic things which he will be associated with, like a thermal scanner, a BP apparatus and a stethoscope. So how to maintain a COVID ICU? First of all, we must have an adequate entrance area, an area designated for donning the personal protective equipment, a COVID lab required for sample collection, the X-ray room attached to the ICU, a store room where all personal protective equipment, stethoscopes, BP apparatus and thermometers are kept, which are to be used exclusively for COVID infected patient in the ICU. This is an initial entry to the intensive care unit. So before the entrance there are some designated beds which are kept for triage. This place where we decide where the patient will go into the ICU. So it is preferable to keep the patients who require only oxygen and who are febrile and a little sick looking in the green zone. So it is meant only for more stabler patients requiring oxygen requirements. Suppose the patient is more tachypneic, tachycardic, is looking more sicker, you just transfer them to the yellow zone where a provision for an additional support can be given. Like before they go to the red zone, a more sick patient, but if the patient becomes very sick, he has to be put in the red zone where he has to be intubated and ventilated. So there is a more area designated for more sicker patients where ventilation facility, a defibrillator facility and suction machine, everything is kept in one area. Nursing station, designated nursing station with adequate facility for hand hygiene, and there is a adequate poster displayed for the technique of hand hygiene, and there is an X-ray view box and notice board for duty roster and additional instructions given by the physician. A crash trolley is required in the intensive care unit because whenever a patient becomes very sick, this trolley can be wheeled to the bedside where a patient who requires inotropic drugs. Be adequate airway equipment present in the intensive care unit, so which consists of a laryngoscope with assorted blades and endotracheal tubes of various sizes, an ambu bag, an adequate suction apparatus, and intubation guides like Stellit or bougie. So you should have adequate suction facility to suck out the secretions in any sick patient. So this constitutes the equipments for airway management. An intubation tray with all the equipments which I just now mentioned will be ideally kept in this tray, and it has to be taken to the patient where intubation is required. This is the portable suction apparatus. Apart from the wall sections at every bed, it is advisable to have a portable suction which can be wheeled in whenever during an emergency where adequate suction is required for the patient. And this is a defibrillator for emergency use, ideally kept in the red zone where there are very sick patients for management of arrhythmias or in case of cardiac arrest. After finishing the duty, the doctors and the staff can come to the doffing area, which is a designated area for removing the personal protective equipment with the required technique, and the staff should do proper hand hygiene before exiting the ICU.